Hello, everyone. Thanks for watching this clinical corner. And our topic today is addressing PPE. So, Betsy, tell us what healthcare workers may be experiencing right now with PPE.
Right. So initially, our problem was not having enough PPE. So I'm glad that we're in a better place with that. But now, what some healthcare workers are describing is they're starting to get skin redness, acne, and even skin breakdown around the areas that the mask is touching their face. So across the bridge of the nose, around the mouth, behind the ears. And of course, we want to prevent that because that just makes you more susceptible to infection.
Right. So, what are some things that healthcare professionals can do to prevent some of this and protect themselves?
Right, you can kind of prep your skin beforehand. So about 2 hours before your shift, wash your face really good, let it dry, and then apply some kind of a moisturizer and give it about 2 hours to really soak in. And then when you get to your shift, you can get a non-alcohol barrier wipe. Just kind of wipe that around the areas that the mask is going to be touching you. Give it about 90 seconds to dry, and then that will give you another barrier between the mask and your skin.
Right. Absolutely. And what if you have significant skin damage from PPE?
Yeah, if you start to notice that you're getting redness, some people have been putting dressings under their mask, so it's a little bit easier with a surgical mask. They might use some kind of a foam dressing. It's a little harder with an N95 because, of course, it has that really tight seal. So if you're wearing an N95, you might want to talk to your facility, to your supervisor, to find out what you can do, if you can wear some kind of a dressing underneath that, and then you might need to be refitted for your N95 if you're going to be wearing some kind of dressing underneath your mask. And if you notice you have skin breakdown, then you really need to have a conversation with your supervisor. You might need to do something where you change your schedule, where you have several days off in between your shifts so your skin has time to heal, or maybe they would float you to another part of the hospital where you wouldn't have to wear the mask for a full 12 hours.
Thank you, Betsy. That was all very helpful information. And thanks to all of you that are continuing to put yourselves out there every day. We can't thank you enough for the sacrifices you're making to the patients that need you the most. If you guys have any additional comments or questions, feel free to reach out below and we'll work together to address those comments or questions. Thanks again for watching.